Hey everyone, welcome back. So my name is Monica and today I want to talk to you all about prison nursing. So I have my public health rotation currently in a medium security prison, and it's not federally, it's state run. So I wanted to kind of research some information about prison nursing because it's like a whole new world in there, and in case any of you are interested in possibly exploring it, maybe in clinical or looking for a potential job, you have, a little thing, because I thought it was so interesting. So one of the reasons why I really wanted prison nursing to be one of my clinicals is because I've always wanted to see like what it's like to be like in prison nursing, like not to be in prison, oh my gosh, but like there's not really like, you can't like take a tour as a public member, obviously. So I thought it was a great way to like kind of see what it's like in there. I'm really into true crime and like the psychology of psychopaths, narcissists, and so I thought it would be a great opportunity to kind of see that firsthand. So my clinical is at an all-men's facility. It has a good amount of inmates, definitely over 500, and so I was interested to see how that kind of works, because everyone always talks about how prisoners get free health care and yada yada, so I wanted to see what it was like. So currently at my facility, there are usually around 3 nurses working at a time, and they have 2 medical assistants and 1 doctor and 1 nurse practitioner. So when you're talking about like 1,000 inmates and 1 doctor and 1 nurse practitioner, that's a lot of patients to see. So because of that, it takes a lot of time to actually get in to see the doctor. Unless you're emergent or a really pending issue, you're really not going to get seen for definitely about a month or so. But here's some of the things that I thought were kind of interesting. So in the United States, there are about a little under 2,000 state prisons, 102 federal prisons, and a little over 3,000 local jails in the United States alone. So that's a lot of facilities that need nursing care, and yeah, there's a lot around. So a little difference, so state-run prisons are run by the state, and then federal ones are run by the federal funding and everything like that. So I know, so there's a few like medical centers specifically in the United States. Like I know there's one kind of in the area where I live, and they're just a federal medical center, so they're funded by federal tax dollars, and they address more needs that wouldn't be addressed in like a state prison. So definitely a lot of chronic illnesses, a lot of older gentlemen and women, so that kind of thing. Also too, psych is a big thing in prisons. I know at least in my facility, 35% of the gentlemen there have some kind of mental disorder, and I actually looked at the statistics, and they're much higher in most places. So usually, nationally, the state prisons had a 73% mental health disorder rate for females and 55% for men, so that's huge. And then the rest of the federal is a little lower, it's 61% for women, 44% for men, and the jails are 75% for women and 63%. So also too, if you're wondering, jails are usually more temporary, so lesser sentencing. Sometimes it can be a holding space until they can find a spot for them at a prison. So that's kind of what your local jails are going to be. So you won't have people in jails for like 5 years, so that kind of thing. Yeah, so based on that, there's a lot of mental health needs in prisons and jails as well. So there's going to be a lot of, schizophrenia, bipolar, depression, anxiety, all these different kinds, psychopathy, all these different kinds of mental health disorders that may have contributed them to going to prison. Maybe they weren't taking their meds correctly. So that's something that definitely, if you want to work in prison health, you definitely have to have an interest in psychiatric nursing, I would say, because it's a pretty big prevalence there. I know some even federal medical centers, the one that I toured, they did have a separate psych facility. So, and you see like, oh my gosh, it was just a different world, you know what I mean? So yeah, so if you're interested in psych, I would say definitely consider prison nursing. Some of the benefits for prison nursing are definitely And this is all too individually, of course, but, you know, a lot of prison and jails have like a public health reimbursement rate. So this is like, if you look under the public health organization, sometimes they can reimburse your tuition or pay back a little bit of your loans. It could be up to like 60% if you work for them for upwards of how many years. So that could always be an incentive for people. If, you know, if you work at these facilities, you know, they could potentially have a loan reimbursement, which is huge, and that's awesome. So something to think about. Another thing too is being like state or federally run. Some of them do have pensions as well. So if you work there for how many years, it also depends on the facility. It could be 5 years, it could be 20 years. You could qualify for a pension. So after you retire, you get a stipend every month. Even when you're not working, you'll get a stipend after you retire for money. So that's a huge thing that a lot of like hospitals and stuff don't have. So if you're interested, that would be another benefit as well. Also too, I think if you're really into serving underserved populations, that prison health would be really great, just because, you know, a lot of them, you know, don't have kind of a primary provider outside, you know, on the streets outside of prison or jail. So to have that care, in my experience, I was a little scared that they'd be pretty disrespectful. But most of the time, most of the prisoners that I worked with, the inmates, have been pretty respectful. You know, you're a caregiver, you're providing care for them. So most of them are pretty respectful, and that's something that I was a little worried about, especially being a female and everything, but it really hasn't been a problem, and they've been pretty respectful. So I thought that was nice. Also too, if you're wondering like the difference between like minimum and medium security facilities, so minimum security prisons would be people who had like white collar crimes, so like tax fraud, maybe not paying their parking ticket and refusing to go into court, that kind of thing, or like low offense drug crimes. And then medium security, which is where I work at, they have, you know, more serious offenses, so assault, battery, rape, sometimes murder, that kind of thing, and then higher drug offenses as well. And then maximum security is going to be like very, so mostly they'll, you know, could be in solitary confinement, or they have their own room based on that. So and those are people who have committed very serious crimes, multiple murders, yada yada. So that all kind of depends. So if you're looking into like what prison you want to work at or interested, definitely look at security levels, because that'll kind of tell you what kind of inmates will be there. And also too, if you were thinking about either men's or women's prisons, there's pros and cons to both, I think. Like with men, if you're a woman especially, you know, they don't really see a lot of women there, so you might get some attention, unwanted, I should say. So maybe some inappropriate comments, but I feel like as nursing, I mean, I can't speak for correctional officers, I feel like they would get a lot more disrespect, but I think as a caregiver, as a nurse, you would get more respect, sadly, because, you know, everyone should be treated with respect there, especially, but I haven't really dealt with any disrespectful comments or anything, so that's been really nice from the nursing side. Yeah, and then women too, I don't know, like I thought like, oh, what would it be like to work in a women's prisons? There might be, you know, I don't know. You know, sometimes like when you get a bunch of women around, they can be really manipulative, really conniving, gossiping, you know. So there's pros and cons to both, I think. Also too, when it comes to like healthcare things, and like in hospitals, like in everywhere, there's gonna be manipulation. So some of the inmates might come in, say they have this really intense pain in their knee, you check it out, you know, have you been exercising, you know, have you been going into recreation, which is, you know, their time to play like basketball or that kind of thing. And if they say like, yeah, oh yeah, I have a game tomorrow, then you're like, oh, so are you really in a lot of pain if you're playing a game tomorrow? So some of them, you know, again, these, you know, a lot of these inmates, they have a lot of time throughout their day, and some of them have nothing to lose. So they might try to manipulate you to, give them some, like, a specific dose of a pain medication, or to get them onto the lower bunk because then they don't have to jump up. So it's that kind of thing you have to keep an eye on too. Keep an eye on, I would definitely say, is like knowing like who's trying to manipulate you, because you have to think the population you're working with, Some of these men or women, have done this for a long time, and so they're pretty good at it. So you just have to watch yourself, I would say. But that's also the same in the hospital too. There's a lot of people who try to manipulate the system in the hospital as well. So, but you have to think about who you're working with. Yeah. Also too, something that I didn't know before prison, where I had my clinical in a prison, is that, at least in my facility, the prisoners have to pay a copay if it's for an initial visit. So if they're coming to you for the first time about knee pain, that would cost them a fee. I think it's over $5. So some people might be like, oh, that's terrible. I mean, I think it's personally a good thing, like it teaches them, like, when they leave the prison, like, they do have to pay for this stuff. There are co-pays associated with it. And then in my facility too, they also have to pay a certain dollar fee for their medications as well. But all the prisoners there have jobs who are able to work. And I think that's a great thing as well, it gets them into a routine of getting up and going to work. So when they get out, it'll, that routine hopefully will stay with them of getting up to work. Yeah. So a thing about prison nursing that took me a lot to get used to is not shutting the door. So when you normally at a hospital or in your clinic, or you're in a patient's house or something, like, you always like provide privacy. You always shut the door. You always put a curtain over, something to provide privacy for the patient. Well, in prison, you don't. You just leave the door open. And if you're exposing them, because I'm working in a male prison, so underneath like their hips, then you have to like put a curtain out, but you still keep the door open. So you leave the door open at all times, and you only put a curtain over them if you're exposing underneath their hips. So that was so interesting to me, because like everyone can hear walking by, but it's for your safety as a nurse or as a healthcare member. So I understand why, I totally do. I'm not saying that they shouldn't be like that, but it's just different to get used to. Another thing too about prison nursing, it's a lot of triaging. So if you're really into kind of priority and everything, you're the ones deciding who gets seen first and what order. And then, if the doctor has time, which they're usually really busy, they're seeing other people's appointments. If you have a possible infection, like, you have to schedule in the day when the doctor could maybe poke in her head or his head and see what's going on. So it's a lot of triaging. And then also as a prison nurse, you have to be really like creative when it comes to supplies, because you're not going to have the resources that you would at like a local hospital or clinic. Being run by tax dollars, you have definitely the bare minimum of what you need. So you might have to order things, and that takes time to come in, like a splint that's for the left hand or something like that. So you have to be creative when it comes to supplies, and working with what you have. So yeah, I'd say the main thing that we do is assessments, wound care as well. Patients have wounds, you come in and you take care of them. Yeah, so triage, assessments, and then so if you're really into like just certain skills like putting in IVs or NG tubes, all of that, they wouldn't do that there. They'd send them off to a hospital to do that. So if you really like the skills part of nursing, like the hands-on stuff, then I'd probably say it wouldn't be for you. But if you like that kind of challenge of like triaging, assessing, yeah, I'd say it's pretty good. But overall, I think it's really interesting. I think the culture of prison, it's completely different than out here. Like in there, gum is hot commodity, or even Vaseline at my facility. My facility is really big, so kind of watching what you give people. But of course you still have to, and then also too, I would say one of the main things that I think has helped me is not looking up what brought them to prison. And this is a hard one because, like, you know, I feel like a lot of people, I guess, are curious. You know, we want to know, like, oh, what did this person do? What did this person do? Or, like, you'll see, like, a really old gentleman. You'd be like, oh, it's like a little grandpa. It's like, well, then what did he do to get into a medium security facility? You know what I mean? And, of course, there's innocent people there. There's innocent people everywhere. But, you know, a very small percentage. So that's something that I have had to, like, control myself to do in order to not look up what they did. Because personally I know it would make me care for them differently, which I know sounds bad, but you know, if I found out that this old man I was taking care of, I don't know, did something terrible to his wife or grandson, that would probably make me like look at him differently and have less compassion and that kind of thing. So that's why I really would not recommend looking up what they did, because maybe you can get over it and you're totally fine. With me personally, I couldn't. You know, like, it was crazy. I don't know. Like, you hear of, you know, people who, you know, like, oh, you know, you take care of a guy and then you find out, like, he stabbed and, you know, killed his girlfriend. So you're like, oh my God. And then, you know, if he was complaining about something benign, like, oh, I can't sleep, you might not, you know, have as much compassion. So that kind of thing I'd be careful about. Yeah, so if you guys have any more questions about what it's like to, like, have a clinical in a prison, I'd be happy to answer them. But overall, it's been a really great experience. I've definitely learned a lot, and the culture of prison is so fascinating to me. Of course, I'd never want to, like, go to one, but, like, be in one. But I don't know, just it's a different world in there, definitely, where a lot of manipulation happens. You know, there's some good things too. They have good programs, but those are hard to get into, and yeah, there's some fights that go on there. So yeah, so all right, I hope you guys have a great day, and I will see you later. Bye.